Mark says, coming from 12 years background in clinical practice, this is a topic which is very close to my heart. I'm sure many of you yourselves from hospitals and health systems will be familiar with how disheartening and frustrating it can be for frontline staff to see the many little problems affecting everyday patient care and good operational management in the hospital, but actually feel relatively powerless and able to address these. Now for us, operational excellence is a way of working, a culture, if you will, that empowers those frontline staff to be able to address those issues. And in doing so, it frees up middle management and senior executives to be able to concentrate on the bigger picture and more strategic opportunities for hospitals and health systems to deal with. We asked them about the challenges to continuous improvement, and one of the key points that was flagged was really ensuring that senior management have the buy-in. They actually walk the walk and don't talk the talk. They understand that behaviour change in themselves is required and that this isn't just something that they're doing to other people. We heard from many about the importance of getting the balance right. Many of the organisations we spoke to, with the benefit of hindsight, realised that they'd perhaps been too conservative in this and perhaps underestimated the resource and duration of investment in this that was required to deliver this change. They spent a lot of time planning and thinking and realised in retrospect they wished they'd spent more time getting on acting and doing. And perhaps one of the most important factors is understanding that to get this right, it requires the implementation of a complete management system. We thought that actually one of the neglected areas was the middle management when you're trying to implement these systems, and that's absolutely what we heard from the senior leaders that we spoke to. Many of them were on journeys 2, 3, 5, 8 years down the line, and at various points they began to realise that perhaps they had been successful in delivering the senior management buy-in and behaviour change, and absolutely frontline staff had engaged and been empowered, but they realised they'd left the middle management behind. This gap in the middle, wasn't sure how they fitted into this, they weren't sure how to change their behaviour towards one more of coaching than firefighting, and we realised it was really important to ensure that adequate focus was given to them. We heard from organisations that were most successful the importance of focusing in on just a few key points, perhaps just 3 or 5, and giving these all their attention for the whole year, not being distracted and diverted by other issues as they came up, to ensure that adequate time and resources really focused on what mattered to them to move the needle. And we heard that it was really important to ensure alignment between what the staff on the shop floor at the coalface are undertaking and what the overall strategy for the organisation is that they've decided to focus on. Perhaps most important of all throughout of this was ensuring leadership commit and that they have the ability to commit to this, that they understand that long-term commitment, persistence and investment is required to deliver this sort of step change in an organisation to really go from good to great. So, as Mark mentioned, we have our first report. It's a teaser, a prelude to the major report which will be coming out later in the year. It starts to set out some of these issues and share them with you. As we say, we'll be focusing much more on this later in the morning. We will be very happy to talk to you in further detail about any of this, and we look forward to speaking to you more later. Thank you, Mark.